is really the result of periodontal infection. And so we measure it with a little probe, and once it gets over about 4 or 5 millimeters, we know that it's just like a pocket on my jacket here. You have lint down at the bottom, you can't get that out, just like bacteria. So all your brushing and flossing, still the bacteria is down there. So Dr. Nemeth and I have really had the first laser in the country that would allow us to get down here and get that lint, the bacteria, out of the pocket. We started in 1990, and we've done more of these cases than anybody in the world. This result also kills all the bacteria, like we talked about. And we've proven that you can kill the bacteria with the laser. No other procedure ever has been shown to do that. We actually proved that. The old treatment was cutting and stitching, where you'd have a lot of pain, and you rarely would get a result like this.
Let's talk about one of your cases.
This tooth actually had pockets that went all the way to the end of the root. It was 11 millimeters, the pocket, all right? So we treated it with LANAP, we grew the bone back, and the pocket was 3 millimeters. So instead of way deep in there, now we got the bone back and got rid of the pocket. And then here's another case. This was a 30-year-old lady, a dentist's daughter. He sent her over, and they said it has to come out and get an implant. Well, the bone loss was beyond the apex, so we were able to treat that, grow the bone back, the tooth got tight again, so that was a pocket that went up here to 13 millimeters. That's about that long, all right? And now we got it back to like 3 or 4 millimeters.